Hey, it's Dr. Barto, and in this video I am sharing with you the impacts of tobacco use, how it impacts your spinal health. Obviously, tobacco use impacts your overall health, but also your spinal health, which is why I'm sharing with you this today. So I'm going to read all of it from this form here. So, okay, in Canada, where the researcher for this is from Canada, there has been a decline in the population rate of current smokers over the age of 15 from 25% of the population in 1999 to 16% of the population in 2012, which is awesome. So they improved 25% of the population to just 12% of the population is a smoker. However, that still amounts to 4.6 million people who smoke. In the United States, it's estimated that over 42 million people, or 18% of all people aged 18 or older, smoke. Cigarette smoking is the leading cause of preventable death in the United States. The leading cause of preventable death, accounting for more than 480,000 deaths, 1 in every 5 deaths every year. That's a lot of people because of smoking. More than 16 million Americans suffer from disease caused by smoking. Many chemicals in cigarette smoke, including nicotine, restrict blood flow. This is why cigarettes are so deadly. So we're restricting blood flow. This deprives your spinal joints and your discs of nutrients and increase the buildup of waste products. This can lead to accelerated wear and tear or degeneration. One study using MRI and looking at identical twins was able to show increased degeneration in spinal discs in smokers compared to their genetically identical non-smoking twins. So just smoking increases the wear and tear on your body. The decision to quit is ultimately only something that you can make. But once you draw that decision, get some friends and some family to help support you in that. Sometimes, so some ideas, if you're a smoker and you need to quit, some ideas would be to get some pictures of some gross teeth or an unhealthy lung. So let me tell you, through chiropractic school, we did cadavers. My cadaver was a smoker, and his lungs were like a moldy sponge, like super soft and just gross looking. They were like dark colored rather than pink, and they were mushy instead of firm. Get some pictures of that and know that every time you smoke, that's what you're doing to yourself. So if you do that, then you start to anchor in your mind that that smoking is doing that to you. If you've noticed the vaping commercials, my kids have been, and we'll be watching TV and we see the vaping commercials, and the vaping commercials look like the people vape, and then it looks like they have parasites and bugs under their skin, and things are crawling through their bodies. And my kids ask, is that what happens when you vape? Do you get bugs inside of your body and crawling under your skin? And I said, no, but the pictures on there make you think it's really gross. And so if they can make you associate that with vaping, then you'll be less likely to vape. So it's the same sort of thing in this situation. But the suggestion here is don't look at pictures of cancer or full-blown disease. Just look at the pictures of tar-stained ugly teeth or tar-stained lungs. You might also want to watch some videos of people smoking through the holes in their throats. The better, the more gross the picture, the better. But cancer is pretty sad. And it can also be helpful to stop gradually. So I made a video on writing goals. That would be a good one to look at here. Make a commitment to smoke 1 less cigarette a day per week. And then move to 2 or even 1, and then eventually you'll just gradually taper yourself off. But once you set those goals, then you can develop the action and the choices to gradually choose to do less. Or you might find that what your trigger is. If you're under a lot of stress, you might be more likely to grab a cigarette. But why don't you try, instead of doing that, before you go for the cigarette, go for a walk and see if that doesn't help you relieve your stress some, and you'll be less likely to pull that cigarette, or maybe you'll be out of time and not be able to smoke as much. So nicotine is really addictive. So it's not, if you've been doing this for some time, at this point, it's not purely just choices. You have to wean yourself off of that addiction. So gradually lessening the amount you intake each week will be easier, and it's going to be more sustainable than saying, I'm just never doing again. It's just that's an unrealistic goal. So, show yourself some grace and forgiveness and ease into this better, healthier habit.